Hello, I'm Dr. Miles Weinberger. I've been involved in dealing with chronic cough for 50 years, and I'm going to talk about how I've cured chronic idiopathic cough in adults and children. My current position is as a volunteer visiting professor of pediatrics at the University of California in San Diego, University of California in San Diego. And I spend time at Rady Children's Hospital, which is part of that. I'm a professor emeritus from the University of Iowa, where I had run a program that involved a clinic for respiratory problems in children for 40 years. You can contact me if you want at this email, and you can find various publications related to what I'm talking about at this website. So let me start. Chronic cough can be a terrible experience, often continuing for months and years. It's generally initiated by a common cold, sometimes recurring with common colds. Some people have it recurring. It can interfere with occupational and social functioning in both children and adults. And I'm talking about a specific type of chronic cough, and I'm going to show you some examples. So this was a 10-year-old boy with almost a month of coughing like that. He contacted me in September of 2023, and the history was that the cough persists daily during most waking hours. He's unable to attend school. He obviously had a lot of anxiety and stress because of falling behind in schoolwork. This is another patient with this. This problem is all over the world, and this particular child is in Mumbai, India. So imagine having this going on multiple hours all day long. And in this child, this is the second episode of habit cough. He had a first episode earlier, went on for a couple of months before it stopped spontaneously. But now his current one has been going on for 3 months and not showing any immediate signs of stopping. His father estimated that there were over 800 coughs per day. Notably, and very important, both of these children had no cough when sleeping. It's a characteristic of this type of idiopathic cough. And it occurs also in adults. I got this email from his father, who was a physician in Hessen, Germany. Told me his 36-year-old son was a rabbi in Germany. He'd been coughing for 6 years. He averaged about 7 coughs per minute, worse in the evening. Obviously, it had considerable social consequences. Hard to function as a rabbi coughing like that, or probably very difficult to cough, to function has anything with that degree of cough. So what causes a cough like these? Chronic cough can be from various causes: infection, cigarette smoking, asthma, some particular drugs falling into the classification of angiotensin converting enzyme inhibitors, and also various pulmonary disease. But these patients I showed you, all three of them, the two children and the 36-year-old adult, they had no physical cause. They were all suffering from the habit cough syndrome. Habit cough is a dry, repetitive daily cough that is absent during sleep, but returns upon awakening. Now, I've used the word habit here, and habit, sometimes people think of that as voluntary, but the medical definition of habit is an acquired mode of behavior that has become nearly or completely involuntary. And this goes way back to a millennium ago. Galen, a physician and biologist, who was the first one to start talking about experimental physiology, he described habit that it's a permanent and durable affection, whether that be good or bad. And the type of experience that you saw in those patients, it has been repeated by others. I've had 50 years of experience studying chronic cough in children and found that those without a cause had a habit cough. And cough cessation could occur by a simple behavioral technique known as suggestion therapy. I have now had experience that similar cough cessation can occur in those adults with chronic cough that has no cause. And also, regarding chronic cough in adults, it's been shown first by Dr. Rubiat Hawk, who had a specialty cough clinic, reported in 2002 that 40% of the adults referred to his clinic had no cause for their chronic cough and were refractory to usual treatment. I want to do a little historical review of prolonged cough in adults, as it provides some insights into the current conundrum of chronic cough, particularly the chronic cough in adults, where there is no diagnosis and it's refractory to usual treatment. 300 years ago, Franciscus Mercurius described habitual cough, which often continues after the first cough, which was caused by the cold. The cold is gone, and the habitual cough often proceeds. That is, the cough from the cold goes away, and the habit cough continues. And we see this all the time now. Parents often say the child got a cold, and he coughed like all other colds, and then the cough changed. It becomes this type of habit cough. And I'll talk more about that as we go. Here's another one, another habit cough description in all the old literature. And Thomas Willis previously described a woman, he didn't call it habit cough, but it was exactly like the kind of habit cough we see in adults today. She had a violent dry cough, produced no sputum, following her day and night unless she was falling asleep. Think, is there really any physical cause of cough that can cause the frequency of coughing that you saw in the two children and the adults in that slide? That totally stops once they keep sleep. It's not so. Asthma is characteristic by having cough during sleep, and any other cough going on as frequently as we're demonstrating in these patients just don't fit any physical cause of cough. And again, from one of the old literature, I won't read the whole thing, but again, describing a violent dry cough, except when she was sleeping. Now, a little more recently, in the 19th century, 100 years ago, Charles Crichton described a habit cough, a reflex effect persisting after the cause is gone, or an acquired habit. And so he recognized it, that this was medically a habit cough. He also had some insights saying the treatment of it is to break the habit. We'll talk more about that as we go on, because it has to do with how the habit cough is treated today. And let's put habit cough into an overall picture of a habit disorder. So what is a habit disorder? As the American Psychological Association talks about habit disorders as an acquired mode of behavior that has become nearly or completely involuntary. And they state habit disorders can be treated and cured. So examples include tics, a strange disorder usually in women, girls, trichotillomania, chronic hair pulling, they pull their hair out, they can't stop, compulsively pulling their hair. There's compulsive skin picking and scratching, compulsive nail biting, compulsive teeth grinding. And habit cough is in that list of a habit disorder. And coughing, it's a compulsive cough, and they cannot stop themselves just by will. Now, the first person to demonstrate a behavioral method for stopping chronic cough like this was Dr. Bernard Berman, an allergist in Boston. He had 6 children in his practice. They all had a chronic dry barking cough that was absent once the child slept. And he stopped the cough in all 6 by what he called the art of suggestion. We'll talk more about that. So this is Dr. Bernard Berman, and he deserves a lot of credit as being the first person in the modern literature that demonstrated cures for the chronic cough that we call habit cough disorder. Here's one of his first publication. He describes these cases. When Dr. Berman saw these, put together his 6 patients that he had accumulated over a 5-year period, he thought about what it should be called, because there had been isolated case reports that called it psychogenic cough or I don't know where tick cough came from, but that was one of them. But he said, this obviously wasn't a tick. It was a cough. And there's a difference between a cough and a verbal tick. Verbal tick is a specific sound, a word. It's not a cough. A cough involves taking a deep breath, closing the glottis, building up pressure behind it, and opening the glottis and letting it out. And it causes vibrations because of the compressed air coming out when the glottis is open causes a sound that everyone would recognize as a cough. It's not just a sound made orally. It is a cough. So it's not a tick. Right? Also, the 6 children he'd seen were normal. They had no psychological problems. It didn't make sense to call it psychogenic cough. And because he was able to stop it with a simple behavioral technique, he said, this fits the pattern of a habit cough. Now, I first saw one of these children with a child like that with the same characteristics when I first started a practice in Orange County, California. But then when I went to the University of Iowa and took charge of the allergy and pulmonary division, we started seeing kids like this. And when we saw them, they were referred. So the referring physicians had generally tried treating them with all known causes of cough that they knew about. And despite those children having those previous months of coughing, actually 18% of them have been coughing for more than a year. So they've been coughing for a long time. In all cases, with a few exceptions, there was prompt cessation of the cough with, again, a variation of what Bernard Berman talked about. We call it suggestion therapy. My colleagues and I at the University of Iowa saw children with habit cough that we treated, as I said, with a variation of Dr. Berman's suggestion therapy. And when we examined our experience over a 20-year period from 1995 to 2014, we had made the diagnosis 140 times. Now, the last 12 years of that, the annual average was about 9 per year. And another center, the Brompton Hospital in London, England, also reported about 9 per year over a 6-year period, for a total of 55 children that make the diagnosis. The diagnosis is made purely on clinical criteria because the nature of the cough is so distinctive that there is no need for any tests other than perhaps some routine pulmonary function, maybe a chest x-ray, just to provide convincing evidence that there's nothing else going on, that there's no physical cause for the cough. And that estimate of 9 per year is probably what is likely to be seen at other referral centers in the United States and probably other countries. Both our colleagues in London and our experience was that the diagnosis could be made just by the coughing like you saw at the beginning. And it is so characteristic and distinct from other causes of cough that further evaluation and therapeutic trials for other causes of cough were considered unnecessary. And that's part of what causes suffering in the patients. It's because people don't recognize that it's a habit cough and do all sorts of studies and trials of all medications of other causes of cough that are more common than habit cough. A characteristic that was consistent in all of these patients, despite the frequent daily coughing, there was no cough during sleep. So you have this severe coughing. Parents would comment, it was wonderful when the house became quiet. They knew that the child was sleeping. Now, the behavioral technique we used had been almost exclusively in patients in front of us that we'd see in the clinic. But then we had the experience of using that behavioral technique, suggestion therapy, for the first time, providing it remotely by teleconference. We did that because this young lady, 12-year-old Bethany, had been coughing. Father had called me, had contacted me by email and told me about Bethany coughing for 3 months daily, and absent coughing would only stop when she was sleeping. And so for the first time, I used suggestion therapy remotely. And I'll show you some of that shortly. That session was recorded and put on YouTube, and by her father, and her father also started a website that he called habitcough.com, where it can be viewed. At that, it's also on YouTube, and it can also be viewed at habitcough.com. The video of remote treatment was then available on public forums, available for all to potentially find. And so people would search the web often for an explanation for their chronic problem or for their child's chronic problem. And they would find me providing suggestion therapy for Bethany Bittner. Now, over the past 5 years, we have received a total of about 300 emails from people who had found the video and viewed it. Again, searching the web for an explanation of the peculiar cough of their own child or their own cough when it was an adult.
I could do anything any kid could do before my cough. When I couldn't stop coughing, it made me really sad. Dr. Weinberger taught me how to make my cough go away in only 10 minutes.
Yeah. I told you, right? The total number?
Yeah. We don't want to keep count, but we just want to.
No, no. She wants to tell Hunter. Shh, tell him, look.
I planned on recording audio only, but about 3 minutes in, I realized something really incredible was happening. I picked up my wife's phone and I began to film because no one would believe what we were about to see.
Great girl. You've done it. Over 3 minutes. Hey. Don't. Once you cough once, try not to let it happen again. Just try and hold it back because that causes more irritation and makes you cough more. But you did it for over 3 minutes. Okay. Did it get a little bit easier that time? Still hard though, huh? Okay, we're going to go for 4 minutes now. Yeah. Okay. You're doing it. You're doing great. You went 3 minutes before you coughed. So I'll bet you can do 4 minutes too. Because you're taking control. You're not letting it control you. Okay? So this is what you have to keep doing. You may have to do it for a while. It's going to gradually get easier. Gradually gets easier. Okay. I think you can do it yourself for a while now, can't you? Okay. Let me talk to your mom and dad. But you keep thinking by yourself. You keep control. Mom and Dad, are you there?
Yes.
Most of those were from parents whose child had a chronic cough, and they were looking for an explanation as to why, because their own doctors did not recognize habit cough. It wasn't something they had previously learned about. And over 100 were from adults who expressed concern about their own cough. All the emails were filed. I've got files of all of these. And if anyone ever wants to come and inspect them to see the credibility of this and read the parent's description and the patient's description of their own cough. Now, not all of those emails had sufficient detail to know for certain that their cough stopped. But we did have over 90 children, well over 90 children, experience cessation of a habit cough that was documented, as have almost 40 adults from watching the video. So those were ones where the emails documented that they had watched the video and stopped coughing. And this is a map that reports of habit cough cessation from watching the video. We also have on here medical centers where we've provided an education so that physicians and other medical centers that know how to stop chronic cough by using suggestion therapy. So this has happened just over these past 5 years as we've talked with many of these patients or many of the parents, or they've provided us with emails saying they've watched the videos. They've watched the video of me talking with Bethany, stopping her cough, and that enabled them to do the same thing. Some examples of this: Abby Cutler from New South Wales, Australia. Again, coughed only during waking hours, for 5 years. She, of course, had countless misdiagnoses and iatrogenesis. Iatrogenesis means problems caused by the physicians themselves not recognizing that it's habit cough and trying to treat with everything that they never used for any kind of cough, and it doesn't work. A very strong characteristic of habit cough is it doesn't respond to any medication. It's not worth all that effort and that iatrogenic effect. Physicians using things that don't work, that we know that an habit cough doesn't work. And Abby's mother found Bethany's video online. And this is an example of how, as she watched, and she's watching it here now, you can see she's watching it on the screen, me talking with Bethany, and we can see her cough starting to decrease in frequency here. And this is a blow up of that. And so she's coughing frequently. These are individual coughs, each of those spikes. And as she watches the video of me talking with Bethany, it disappears.
I'm Abby's mum. Your child's cough might be habit cough. Watch Abby's instant cure video utilising the Weinberger procedure. It's amazing. Tell your doctor what you've seen. Dr. Weinberger is providing this miracle Weinberger procedure as his gift to hopeless and forsaken children and parents in Australia and around the world for free.
If you start feeling anything, don't take a lot of water, but just a little sip. Okay. So what we're going to do for a little while is some of the things I told you, but I'm going to help you a little bit. You're still going to do it. Okay. First thing I want you to do is keep looking at me and listen to me, even when you start to feel like you're going to cough. Okay? And we'll start going just for a little bit. And remember, it's hard to cough, right? Very hard. Because it's hard to concentrate on just holding back a cough. It really takes a lot of thought. So I'm going to watch my watch here. Where you start to cough, as soon as you feel that, concentrate on holding back the cough and take just a little sip of water to ease that feeling. Okay. So, keep looking at me and concentrate. And let's go just for half a minute now. Instead of coughing, slow deep breath. Slow again.
My full session with Dr. Weinberger is on our website.
Hi, I'm Abby, and here goes me trying to cure my habit cough with just Dr. Weinberger's suggested therapy. I'm gonna not cough for 15 minutes. I usually cough for what feels like 100 times per minute, and I've been coughing for the past 5 years. So here I go. Thank you so much, Dr. Weinberger, for helping me. Now I know how to control my cough.
Now, there's something incredulous about this, that the results of cough of this severity, a cough cessation, can occur from watching a video of successful cessation of chronic cough. But despite the fact that this observation was unexpected and really not intended by what we've been doing, it has now become the most frequent means of curing habit cough in both children and adults. We call this suggestion therapy by proxy, and that there was no healthcare provider involved other than the video. And this was a publication that we described about that. And all these publications are in peer-reviewed medical journals. And not only did we get emails from parents whose child was coughing and coughing stopped from watching the video, and from parents and from adults also. Dennis Bittner looked on the web at various social sites and found that others who we couldn't identify were also describing cessation of coughing from watching the video. Now, we don't have a systemic long-term follow-up in all of these, but we've contacted a number of them, both by email and talking to many of them. And what we've seen is permanent cessation of cough. In other words, once they know how to stop it, it stays stopped. Relapses occurred in a few, but the memory they acquired from the initial cessation permitted successful self-cessation of their cough. As another example, here is a 11-year-old boy from Canada being cured from this, what's sometimes called a horror cough, horror habit cough. He had a satisfying 30-minute telemedicine call. And Dad says, I am still beside myself with happiness about it finally being gone. And this is the kind of experience that we've seen over and over again. Here's another one. This one from Scotland. Shira McClavey had just settled down to watch a DVD when she heard her daughter coughing. And that coughing went on for a 14-month period, averaging about 100 to 150 times a day. The child, Tess, life was disrupted. She was unable to go to school with that coughing or to see even friends in Glasgow because the friends' parents would think this is possibly contagious, and they were afraid of having Tess in their home. But her mother showed the video to Tess, and mother had some contacts with the newspaper, the Scotsman, which is a daily newspaper in Scotland, and they put this very nice picture and long story. I'm not sharing the whole story, but again, emphasizing she was cured by what the mother called a 10-minute video call. So what's the mechanism of this suggestion therapy? Very peculiar, very strange to have this severity of coughing going on for long periods of time, absent when asleep, but a simple behavioral contact, simple behavioral method could stop it. And either by personal contact, as when we were in the clinic, by remote contact, as with Bethany, or an indirect contact by watching a video. Whatever the mechanism, no question that we've seen its effect in hundreds of children and enough adults to warrant further explanation of otherwise healthy adults with daily chronic cough that is absent once asleep, that has been a conundrum for adults with chronic cough going to a cough clinic, and or the large number that I mentioned before don't have a diagnosis and don't respond to any treatment in published guidelines that doctors use to sort out what causes cough. They can't get an explanation for those adults, and they can't make them better. So, to try and explain what is going on with this, I went to psychology literature and found that there is quite a bit of investigation and studies by psychological scientists about the power of suggestion, the ability of suggestion to influence behavior and physical symptoms has been repeatedly reported in the psychology literature. Now, there's a current hypothesis that chronic cough that is not responsive to medication is due to neural mechanisms of chronic cough. The hypothesis is that there's a hyperexcitability of the neuronal pathway that controls the cough reflex. And that involves areas in the brain. But from my reading of the literature, that hyperexcitability may be an effect of the cough itself. Now, its repeated coughing has been shown to be, or been suggested to be, a cause of increased inflammation and increased nerve ending density in the airway. Now, if that's so, then it's the coughing that is the cause of the cough. The coughing causes a neurological inflammation that is a constant feeling that there is something in the throat that makes them cough. And so I think the coughing itself is what causes the hyperexcitability and not necessarily a central neural pathway that others are hypothesizing. Repetitive coughing is posed by the cause of the as the cause of the mucosal abnormality that has increased density of nerve endings, causing increased sensitivity. And this was consistent with an earlier publication by Richard Irwin, who saw inflammation in the mucosal membrane of the airway that was caused by the incessant coughing and could be an explanation for the chronic cough itself. Now we know that cough can be suppressed non-pharmacologically by suggestion, also based on the strong placebo effect in controlled clinical trials of a new cough suppressant, gefapixant, that has been tried. Well, gefapixant was statistically more effective than the placebo to a small extent. The effect of the placebo was much greater than the difference between the placebo and the gefapixant. That's shown here in this slide that was published within the past couple of years. And what you see is gefapixant at 2 different doses causing a decrease in a measure of cough. But the placebo and the direction of placebo is, if anything, greater than the difference, this difference between the active drug and the placebo. So why such a large placebo effect? Well, they're taking something that they believe is the drug, because this is a what's called a double-blind placebo-controlled trial. So the patient is taking something that could be the active drug, and there is strong benefit from that. Now, there are different patterns of habit cough that we've seen that we've learned as we've talked with many of these patients. For instance, there was a 62-year-old municipal court judge who reported 10 years of daily dry coughing characterized by spasms of cough every 10 minutes when awake. And that's a little different from what those initial pictures I showed you. So she would go 10 minutes without coughing and then have a vigorous spasm of coughing when awake, but never when sleeping. And she had coughed for over a decade. She said it started as a tickle in her throat. It got worse when she was stressed. When she was relaxing, it was less. And most importantly, she did not cough during sleep. It completely disrupted her family and work life too. When she was home, she was always coughing. It interfered with her position as a municipal court judge. She watched the video where Bethany was cured, and she described seeing the video of me providing suggestion therapy by teleconference to Bethany, and was motivated to stop coughing by the next day, despite acknowledging that she still felt the urge to cough. But she now had strong suggestion from watching that video that she could do the same thing herself. Another young woman described her experience of severe extended periods of coughing, beginning repeatedly after colds. It stopped after viewing the video located at the end of the video documentary. That I'll show you shortly. Oh, this is just as a short aside. This is something that was created by Bethany herself, who's been very much involved with our efforts in people since she was cured with cough. And she's created a 2-hour documentary called Horror Cough Cured, about the history of habit cough and the work she has, that she and her father are doing with me. And you can see this documentary at habitcough.com. Now, we've personally interviewed many of these patients. Interviews of 4 adults were recorded with permission for their interviews to be available for educational purposes. These interviews can be viewed at a link on habitcough.com. So where are we? There is no longer a question that children with chronic cough without a cause can be cured by suggestion. Over the past 5 years, pediatric pulmonologists throughout the United States, and to some extent in other countries, have learned to recognize habit cough as a unique form of a clinical problem, and many refer people to watch the video, and many pediatric pulmonologists have learned how to do suggestion therapy on their own when seeing the patients. And that has now become the standard of care at many hospitals and medical schools, medical centers throughout the country. I've given a dozen lectures from Johns Hopkins in the East, LA Children's in the West. Often that occurred because one of their parents has contacted me, the cough was stopped, and then the physicians are very interested in knowing how to take care of that better the next time they see patients like that. And that has now become the standard of care by pediatric pulmonologists throughout the states and some other areas. But, well, most of my past experience had been with children. We started getting emails from adults who had, just like I showed you of the 62-year-old woman who had seen the video and stopped coughing. We've now heard that story over and over again. So that demonstration was useful for people who searched the web for an explanation of their own cough that couldn't be given to them by their doctors. One could ask, are those individuals more suggestible because of their search for an answer? Well, that could only be addressed by some form of controlled clinical trial of individuals not likely to be suggestible. But really, is that important? If adults with chronic cough become aware that others are learning to stop their miserable coughing, they're likely to become suggestible. In other words, seeing others that benefit is itself a strong suggestion that people, perhaps previously skeptical, become believers, and they find they can stop their own cough. Here's another example. Jessica Taranova submitted it and solicited habit cough cure report. She told us that she had suffered from a vicious and violent long COVID pneumonia, but that was followed by habit cough. Now, COVID in someone who's been immunized or has natural immunity is really a cold. Has symptoms of an ordinary cold. Although in some people who are susceptible, they become much sicker. So her chronic cough that followed that remained undiagnosed or misdiagnosed for 3 years. The coughing caused her to be incontinent. To get a pressure at the cough can overcome the normal holding of the bladder, so they become incontinent. And it started interfering with her life so much, she even had thoughts of suicide, became very depressed. But she watched the video of Bethany being cured, and subsequently she was cured. So there is the potential for a non-pharmacological cure for this dry, intractable cough that is absent during sleep with no other explanation. And this is of major importance for the conundrum of chronic idiopathic cough in adults. Specialized cough centers currently encounter these patients without other definitive therapeutic options. Things that are tried are speech therapy, teaching people, which has some amelioration of cough, but does not reliably cause cessation of the cough. Here's another example. Anders, who's an author, written a few books, began coughing, he said, at age 7. And we do have other patients who have been coughing since childhood, and the cough continues into adult life. So his misdiagnosis of habit cough was going on for 37 years. Obviously, he saw countless doctors and specialists, many misdiagnoses, so much iatrogenesis, that is, harm caused by treating something that isn't there. And he found that from watching the video with Bethany, the suggestion of watching that video enabled him to stop coughing. Another example, Gracie Terzian submitted a habit cough cure report on her own before we ever contacted her. We contacted her afterwards. And she said she could not remember a time when she did not cough. She reported seeing the video on YouTube and not only learned to not cough, but she was an influencer and had her own blog to convince others with the same problem that they also could benefit from this. An interesting thing that has happened is, well, that map I showed you that, from all over the English-speaking world, watching the video has helped children who had chronic cough and many adults to help others that don't speak English. We've had versions of Bethany, me talking with Bethany, not just in English, which is the only language that I know, but also in Spanish, German, North Macedonian, Portuguese, Mandarin, Turkish, URTI, which is one of the language of one of the states in India, and Hindi. And our 11-year-old Hindi translator here is a girl that I talked with who was one of the volunteers. This is the 11-year-old here, and she had had a respiratory infection with greater than 6 weeks of coughing. Both her parents were physicians. She was coughing 5 to 6 times per minute. She had no fever. In the course of trying to deal with it and not knowing what it was, she was hospitalized for continuous coughing. We've given medications that are for asthma, for infection, but of course she didn't have asthma or infection, had no benefit. And nothing stopped the coughing except when she slept. She responded to remote suggestion therapy, just like Bethany did. And mother in here wanted to see if they could help others. So the mother did an overlay in Gujarati, the language of the state of Gujarati, and here did the overlay in Bethany.
Namaste. I am Heer Mehta from Ahmedabad, Gujarat, India. I am 11 years old. I was suffering from continuous dry cough for 1.5 months. My pediatrician diagnosed that I had habit cough. So, my parents contacted Dr. Miles Weinberger through habitcough.com website. Dr. Weinberger sir immediately replied and arranged a video session with us. He cured me with his suggestion therapy, which I am going to translate in Hindi. I am also so much thankful to this living legend on the earth. I hope that this video will help you too. Let's begin. शांत रहिए, आप बहुत अच्छा कर रहे हो। सिर्फ और सिर्फ मेरी बात पे ध्यान दीजिए और कहीं मत देखिए। दूसरी कोई भी चीज या व्यक्ति के बारे में मत सोचिए। आपके मन में खांसी को रोकने के अलावा और कोई बात को मत आने दो। आपको सिर्फ एक ही काम करना है। खांसी आने से पहले यदि गले में अजीब फीलिंग लगती है तो तुरंत एक घूंट पानी पीने। ठीक है, कुछ समय के लिए हम एक कोशिश करेंगे जिसमें हम पानी पिएंगे और मुंह से सांस लेंगे और इस दौरान मैं आपकी मदद करूंगी। अच्छा, सबसे पहले अगर आपको खांसी आए या आपको लगे कि आपको खांसी आने वाली है, फिर भी आप मेरे सामने देखेंगे और मेरी बात सुनेंगे। ओके, तो हम कुछ वक्त के लिए कोशिश करेंगे। और मुझे पता है कि खांसी रोकना मुश्किल है, बहुत मुश्किल है ना, बराबर? अगर हम ध्यान लगाकर कोशिश करेंगे तो कुछ पल के लिए हम खांसी को रोक पाएंगे। तो चलो हम कोशिश करते हैं और आप यह कर ही पाएंगे। आप आधी मिनट तक खांसी को रोक पाए हो, तो अब हम 1 मिनट तक खांसी को रोकने की कोशिश करेंगे। ध्यान दीजिए, अगर आपको ऐसा लगे कि आपको खांसी आने वाली है तो तुरंत एक घूंट पानी पीजिए। मेरी बात पर गौर कीजिए और खांसी को रोकने का सोचिए, क्योंकि जितनी देर तक आप खांसी को रोकेंगे, खांसी को रोकना उतना ही आसान होता जाएगा। अगर आपको ऐसा लगे कि आपको खांसी आने वाली है तो तुरंत पानी का एक घूंट पी लीजिए। ठीक है, तब पानी पियो। बहुत अच्छा। अभी और 40 सेकंड के लिए खांसी को रोक के रखिए। जितने लंबे समय तक खांसी को रोक के रखोगे, खांसी रोकना उतना ही आसान होता जाएगा। बहुत अच्छा। आप 3 मिनट तक खांसी को रोक पाए हो। ध्यान दीजिए, आप बहुत अच्छा कर रहे हो। ज़रूरत मुश्किल है, पर आप बहुत अच्छा कर रहे हो। ज़रूरत लगे तो एक घूंट पानी पीना। अब आप कोशिश कीजिए कि आपके मन में खांसी का विचार आए तो भी आप खांसी को रोकेंगे। आप बहुत अच्छा कर रहे हो। अगर सही है, आप जितनी ज़्यादा खांसी खाओगे, आपको उतनी ज़्यादा खांसी खाने की फीलिंग आएगी और उसके वजह से आप फिर से ज़्यादा खांसी खाने लगोगे। अगर मच्छर ने हमें काटा हो तो उस वजह से हम खुजली करना बंद करेंगे तो हमारी खुजली कम होती जाएगी। वैसे ही आप खांसी खाना रोकेंगे तो खांसी की फीलिंग कम होती जाएगी और आपकी खांसी कम आएगी। मैं भी मानती हूँ कि यह मुश्किल है, फिर भी आप कर सकते हो। अगर खांसी को रोकना इतना आसान होता तो हमको इतनी कोशिशें करने की ज़रूरत नहीं होती। और कहीं मत देखिए, दूसरी कोई भी चीज़ या व्यक्ति के बारे में मत सोचिए। आपके मन में खांसी को रोकने के अलावा और कोई बात को मत आने दो। आपको सिर्फ एक ही काम करना है। खांसी आने से पहले यदि गले में अजीब फीलिंग लगती है तो तुरंत एक घूंट पानी पीजिए। बढ़िया। मुझे पता है कि मुश्किल काम है, पर आप बहुत अच्छा कर रहे हो। आपके मन में खांसी को रोकने के अलावा और कोई विचार नहीं आना चाहिए। ध्यान दीजिए और मन लगाकर सोचिए कि आपको खांसी नहीं खानी है और उसे रोकना है। गहरी सांस लीजिए या फिर एक घूंट पानी पीजिए। जब हम अपने मन में ऐसा सोचेंगे कि मुझे खांसी नहीं खानी है, तब हम ज़रूर अपनी खांसी को रोक पाएंगे। यह आसान नहीं है, फिर भी आप यह कर रहे हो क्योंकि आपने 6 मिनट तक खांसी को रोक के रखी है। ध्यान देते रहिए और दूसरी कोई भी चीज़ के बारे में मत सोचिए। मुझे पता है कि आप यह खांसी को रोक देंगे और उसे दूर भगा देंगे, ठीक है ना? क्योंकि अब आप खांसी को रोकना सीख रहे हो और आपको यह करना आ गया है। मुझे पता है कि आपको खांसी बंद हो जाएगी क्योंकि आप उस पर ठीक से ध्यान दे रहे हो। एक बार खांसी आएगी तो दूसरा होता जाएगा। मुझे बताइए कि खांसी को रोकना पहले से आसान हो गया है ना? मैं जानती हूँ कि खांसी अभी तक गई नहीं है। अभी भी आपको शायद ऐसा लग रहा होगा कि आपको खांसी आएगी, फिर भी आप उसे आसानी से रोक सकते हो। आपका मन खांसी आए उससे पहले उसे रोक सकता है। ठीक है, बढ़िया। आपको आने वाली खांसी बहुत कॉमन नहीं है, फिर भी मैंने ऐसी खांसी वाले मरीज़ देखे हैं और सभी मरीज़ की खांसी इसी तरह से, और इसमें मैंने कुछ नहीं किया है। मैं सिर्फ आपको खांसी रोकना सिखा रही हूँ, पर उसको आप खुद रोक रहे हो क्योंकि आपका दिमाग बहुत शक्तिशाली है और आप अच्छी तरह से खांसी को रोकना सीख रहे हो। करते रहो, बहुत अच्छा। और आप अपने आप खांसी को रोक रहे हो। इसका मतलब यह हुआ कि जब मैं आपके सामने नहीं होंगी, तब आप इसी तरह से खांसी को रोक पाओगे। मुझे यकीन है कि आप यह कर पाओगे और अपने आप खांसी को रोक पाओगे। आपको पता है कि खांसी आए उससे पहले आपको और खांसी रोकनी है। गहरी लंबी सांस लीजिए बहुत अच्छा। आप कुछ देर तक आप अपने आप खांसी को रोकने की कोशिश कीजिए। खांसी रोकिए, ध्यान दीजिए। फिर से धीरे से एक गहरी सांस लीजिए और याद रखिए कि आप अपने आप से खांसी को रोक सकते हो। आप जितने जानते हो कि एक घूंट पानी पीने से आप खांसी रोक सकते हो। एक भी खांसी आए तो तुरंत सोचिए कि मुझे यह खांसी को रोकना है। आपको मेरी ज़रूरत नहीं है और मैं जानती हूँ कि आप बहुत अच्छा कर रहे हो। प्रैक्टिस के लिए बार बार इस वीडियो को देखते रहिए। आप बहुत अच्छे से खांसी रोक रहे हो। वेल डन। यदि ज़रूरत लगे तो इस वीडियो को फिर से देखिए। हमारी वेबसाइट habitcough.com पर डॉक्टर वेनबर्गर के द्वारा की गई ट्रीटमेंट का वीडियो है। यह हमारा डॉक्टर वेनबर्गर के साथ का सफल और बहुत अच्छा अनुभव है। आपका अनुभव अलग हो सकता है। आप अपने डॉक्टर, पीडियाट्रिशियन या पल्मोनोलॉजिस्ट के साथ इस वीडियो के बारे में और habitcough.com के बारे में बात कीजिए। यह वीडियो एजुकेशनल पर्पस के लिए ही बनाया गया है। यह वीडियो रोग के निदान और सारवार के लिए नहीं बनाया गया है। धन्यवाद।
That was the overlay of me talking with Bethany. Another insight we've required from successfully curing habit cough with suggestion therapy is that there's a learning process. At first, children and adults often concentrate on acquiring limited suppression of cough. That is, the procedure involved is, hold the cough back for a minute, then for 5 minutes, then for 10 minutes, and then for longer and longer periods. To the point where it becomes learned that it's a cough suppression. Same way you learn any other physical skill. An example that supports that this is a learning thing. Once they've learned it, they know how to do it in the future. Bethany's father contacted me 6 months after she had initially been cured. He said she's got a cold and the cough has started again. The cough has started again. And I told Bethany's father to remind her that she knew how to do it because she'd done it before. And Bethany did and stopped the coughing on her own. I met Bethany a few years later. I asked her about if she could describe, she was a teenager now, more sophisticated. I asked her how she was able to cure her new period of habit coughing. And she had this very insightful description. It's like riding a bike. You didn't ride all winter, but in the spring, you don't have to learn to ride again. You know it. You still have that body memory. And just like riding the bike, that body memory was able to be used on her own to suppress the coughing. I've had this experience with some others, exactly the same thing, where they've been told they did it before, so they know how to do it now. Just remember how you did it, and they do it again. It made me think about analogous learning experiences. Think about a pianist. When they're learning to play, they got to watch the keys. They got to know where middle C is, where the various notes are. But a year later, when they're learning to play, when they've learned to play, the fingers know what to do, know where to go. They don't have to look and identify a specific key. The fingers know how to do it. Another example of this learning to, they're learning to not pay attention to what they're learning to not respond to the feeling that makes them cough. And that enables them to break this vicious cycle of the coughing causing the feeling that makes them cough. So, think about touch typing. I learned that back in high school. I cannot in my mind picture where any specific key is. But when I put my hands in the right place on the keyboard, there's this direct connection between my brain and the fingers. I don't have to look at the keys. The fingers know what to do. So it's essentially muscle learning that occurs in learning any skill, whether it's bike riding, piano playing, touch typing on a keyboard, or not coughing when there's a feeling that wants to make you cough. And of course, once they learn to not respond, and that feeling heals up. I often use the analogy that kids respond to very nicely of a mosquito bite that itches. They scratch it. The more they scratch it, the more it itches. It doesn't heal until they stop scratching. So, although some of these observations of severe prolonged coughing stopping by the power of suggestion sounds incredulous, but in fact it works. Well, it seems remarkable when you first think about it. In fact, it's very consistent with current psychological science, or a cough with no physical cause to be susceptible to cure by a behavioral approach using the power of suggestion. The patient themselves, child or adult, learns the skill to not respond to the acquired urge to cough. Sometimes it happens quickly, sometimes it takes practice over several days, but it happens pretty consistently. And that breaks the vicious cycle, repetitive coughing, causing the cough itself causing the neuropathic lesion that causes the continued coughing, responses to all other known therapy, unresponsive to all other known therapy. Now, it's an important aspect of suggestion therapy, the power of suggestion. For those who watch the video, or for adults where a doctor is going to talk to a child, it's not something you try. When an adult says, well, I've seen that and I'll try that now. No, you don't try anything. Remember the words of the great Yoda, try not, do or do not. There is no try. And for someone who's going to do, like I did and a lot of other physicians have learned to get people to stop coughing by suggestion therapy, it's not something you try. It has to be confident that it's going to work because you know it does most of the time. And that confidence has to be transmitted to the patient. Very important aspect of this. So that's my short story of a long history of identifying and curing habit cough. For more information about this, you can go to habitcough.com, and you can go to my website, which is milesweinberger.com.
The following is a complete session with Dr. Miles Weinberger, MD. It is used at medical clinics around the world with wonderful and satisfying cures. The current reported rapid and permanent cure rate is around plus or minus 95%. With knowledgeable aftercare and follow-up, Dr. Weinberger expects this cure percentage to rise. One renowned pediatric pulmonology clinic recently reported an above 99.9% cure rate. Dr. Weinberger states that even though this is a video of a young child being cured, adults will want to mimic her and follow her lead. Dr. Weinberger's banter is purposeful to the suggestion therapy. He wants the patient to have at least 2 large vessels of body temperature water, not cold or ice water, at the ready, and to sip the water on the pre-cough tickle. Do not gulp the water or sip the water atop the cough. He wants the patient to be in a quiet area with no distraction. He wants the patient to watch this video once per day for the following 3 to 4 days or more to perfect the recovery technique. He wants the patient to keep an opened bottle of water with them at all times, cap off, and to sip atop the tickle, not atop the dry cough. When you have 2 vessels of body temperature water ready and are in a quiet area ready to concentrate, please begin watching. Report any successes, questions, or comments on habitcough.com.
Great girl. You've done it. Over 3 minutes. Hey. Don't. Once you cough once, try not to let it happen again. Try and hold it back because that causes more irritation and makes you cough more. But you did it for over 3 minutes. Okay. Did it get a little bit easier that time? Still hard though, huh? Okay, we're going to go for 4 minutes now. Yeah. Okay. You're doing it. You're doing great. You went 3 minutes before you coughed. So I bet you can do 4 minutes too. Yeah, you can do it. Okay. So just keep thinking, keep concentrating. Yep, you got to concentrate because you've got to be aware of what's making you cough. Because it's kind of automatic, but it's kind of like breathing. Yeah, you don't have to think about breathing, but you can control your breathing if you want. You can hold your breath, you can breathe more. Right? Remember what I said, you start feeling that, take a slow, deep breath, because it helps a little bit too. And in addition to sipping a little bit of water. Great. Great. Have you ever had a mosquito bite? No? You never had a bug bite? Never had anything on your skin that itches? You ever noticed that the more you scratch it, the more it itches, and you have to stop scratching it? This is kind of the same thing. The more you cough, the more it causes that feeling back there that you have to cough again. And just like you have to stop scratching something in order to heal up and stop bothering you, you've got to control the cough, which is harder than not scratching. I'm not saying this is an easy thing to do. If it was an easy thing, we wouldn't be here. It's hard because it goes on and on and on. But what you're doing is learning to hold it back, even for a little bit. And the longer you can hold it back, the easier it's going to get. You've gone almost 3 minutes now. Almost. And you get 1 more minute. Okay? The longer you can hold it back, the easier it's going to get. But it's hard to do. It takes a lot of concentration. Don't let your mind wander. Your mind wanders, and this automatic cough's going to come again. So you got to keep thinking about it. Kind of boring, but it's important. Hang on there. Keep thinking. Yeah. Slow deep breath too. Slow breath. Good girl. You're doing great. Another 20 seconds, you'll have gone 4 minutes. Okay. Slow deep breath. Control that annoying feeling. And that feeling has occurred because of this very long period of you been coughing. I'll look back. Okay, you've gone 4 minutes. You're doing well. Hang in. Keep concentrating. Keep concentrating. As we're going to go 5 minutes next. 5 minutes. Slow breath. Relax, but keep focused on me and think of nothing else but being aware of it before it coughs. Be aware of what you're feeling before. And when you feel it, take a slow, deep breath, take a sip of water, but keep controlling it. Good girl. Good girl. Okay. Deep, slow, deep breaths. Relax. And just keep listening to me and stay focused. Think of nothing else. Okay? You're going to do 5 minutes, and I'm sure you can, right? Because you did 4 minutes. If you can do 4 minutes, you can do 5 minutes, can't you? Right? You can. But it takes a lot of brain power to do that, doesn't it? Yeah, I know. It's hard. Okay? So you keep thinking, keep concentrating, take some slow, deep breaths. Real slow, real slow. Real slow. Very slow. Relax. Stay relaxed. You're doing great. You're doing great. Stay focused. Keep your eyes on me. Don't look anywhere else. Don't think of anything else. You gotta keep your mind working on one thing. On one thing. And that's not responding to that feeling there. I'm not going to do that. You're doing, hang on. Good girl. Good girl. That's right. It was hard. You're feeling it there, right? Take slow, deep breaths. Slow, 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 slow. Right. Okay. Concentrate. Keep your mind focused on that one thing. Don't think of anything else. You're getting all your brain power on one thing, because you've got a lot of brain power, but usually it thinks of a lot of things. So right now you're not letting it go anywhere else except concentrating on when you feel that. Hold it back. Take a deep breath. Sip a little water. Yeah, that'll help. But the main thing is using your brain to hold it back, to control. You're going to take control. You're not going to let the cough take control. You're smarter than the cough, aren't you? Yeah. You're doing great. Hang on. It's hard. It takes a lot. Hold it back. Good girl. Good girl. Hard thing to do. So, you really have to concentrate. Okay, you're doing well. You're doing well. Okay. But the longer you go, the easier it's going to get. The longer you can go, the easier it's going to get. Okay? It's still going to be there. It's not going to go away completely. Not for a day or so, because you've coughed for months. So you've irritated it back there. You've bothered it. And that's what's causing the cough. But if you can stop it from happening, it's gradually going to heal up. And you won't have to cough like you have been. 20 seconds, it'll be 5 minutes. Hey, you can go that much longer, can't you? Yeah. Okay. Yeah. Okay. Feeling it now, but take slow deep breath. Slow deep breath. Good, you're good at this. I can tell you're good at this. Hey, you've gone 5 minutes. You've gone 5 minutes. We're going for 6 minutes now. Okay? You've gone for 5 minutes. Still there, right? Okay. Slow deep breaths. Slow deep breaths. Okay? Keep concentrating, because the longer you go, the easier it's going to get. It's getting a little bit easier now, isn't it, to hold back? I saw it was going to come out there, and you did a good job of holding it back. And that's what you got to do. Your brain has to be the boss here. You have to be the boss, not the cough. Cough is kind of automatic. It just happens without you thinking about it. But if you think about it, you can hold it back. Not easy, but you've been doing it. You've done it for 5 minutes, and we're going into 6 minutes now. Okay. Keep concentrating. Think of nothing else but holding back. Think of nothing else, and take slow, deep breaths when you start feeling anything. Good girl. Hey. Hey. You're going to send that cough packing, aren't you? I'm sure you will. Okay. Now that feeling isn't going to go away completely, not for a day. What you're doing is learning how to take control and not have it keep going, because the more it coughs, the more it's going to cough. The cough causes the cough. So if you can hold back the cough, if you get your brain to do that, it's going to gradually get better. You're doing great. Nice slow breaths. Relax, but stay focused on me. Keep thinking of nothing but the cough, not the feeling that you're holding it back. The feeling of holding it back. And you keep holding it back. Okay, keep doing that. Getting the feeling. Take a slow, deep breath. To relax. Slow, deep breath. Keep looking at me. Slow, deep breath. Great. Okay. because remember, it's the cough that's been causing the cough. The cough causes more irritation there, and it's irritation that makes someone cough. And so you have to break the cycle. You have to break the cycle. You're doing great. Keep holding it back. Keep holding it back. Slow, deep breaths. Keep concentrating. Yeah. You're doing great. You're very good at this. You're very good at this. But it's working, isn't it? You're able to hold it back longer. Each time, you're able to hold it back a little bit longer. Okay? And we're going for 7 minutes this time. 7 minutes, and you're doing it. In 7 minutes. Great. Keep concentrating. Very boring, I know. Just have your mind on one thing. But it's important, because that's the way you get control of something that your body wants to do. And that's what you're doing. You're taking control. You're going to say, yes, I've got that feeling that I have to cough, but I'm not going to let it happen, because I'm the boss. Okay? Slow, deep breaths. Slow, deep breaths. Right. Keep concentrating. Great, you're doing it. It's fantastic. Fantastic. You're really good at this. You're getting there. You're getting there. Yeah, because the longer you go, gradually it's going to get easier. And it's getting a little easier, isn't it? It's not gone yet, but it's getting a little easier to hold it back. And that means your brain is controlling it instead of just letting it happen. Okay? Good girl. Good girl. Okay? Yeah. This is not a real common problem that you have, but you're not the only one in the world that's had it. Mm-hmm. I've seen a lot of other kids with this. Used to be about 7 a year in our clinic, so that's not common, but it happens. Okay. And this is what you have to do to get it under control, to get your brain to take control of what your body is trying to do when you're not thinking about it. Okay. Slow, deep breaths and concentrating. You've gone 7 minutes. We're going for 8 minutes now. Okay. You're getting there, aren't you? Yeah. Feeling you've got a little more control over it now, huh? Yeah. Okay. So we're going for 8 minutes. Great. Just hang in. Keep concentrating. Keep saying, I can control that. I can control it. I can feel it, but I'm going to not let the cough happen. I'm just not going to let it happen. I'm not going to let it happen. Take a slow, deep breath when you need to, if you feel anything. Good. Yeah. You're doing great. You're on your way to an addition to the 7 minutes. And you did 7 minutes in addition to 6 minutes. So you've done 13 minutes already. That you've held it back. Yeah. And you're going to keep doing it. Because the longer you do it, the easier it's going to gradually get. The longer you do it, it's gradually going to get. It's not going to make it feel it go away right away. It's like a bite that you've been scratching. It takes a while to heal up. But until you stop scratching, it doesn't heal. It's the same thing until we until your brain learns to control that cough and not respond to that feeling, it's going to keep happening. Good girl. You're feeling it now, huh? I can tell. I can tell when you're feeling it. And that's when you've got to really concentrate. That's when you've got to really concentrate. Yeah. Slow, deep breaths. Slow, deep breaths. Slow, deep breaths. You know, when you add up the different times, it's getting to be over 20 minutes since you coughed. And that shows you can do it, right? Not easy. We're going to go longer because the longer you go, the easier it's going to get. The longer you go, the easier it's going to get. That's what you have to be thinking about, because you're controlling it. It's not controlling you. You're the boss. Your brain can control it, not just respond to that feeling. Okay, good girl. Okay. You're doing fantastic. You're really doing well. Feeling is still there, but you've gone more than 20 minutes controlling it. Okay, we'll keep going a few more minutes because I want you to keep controlling it. Because keep in mind, you're the one that's controlling it. I'm not doing anything except teaching you what to do. You're the one doing it, which means you can keep doing it even if I'm not there, right? I think you can. Because what we're doing here, you can do on your own later if the feeling is still there and starts bothering you. And if you do this, if you keep thinking about it, again, the longer you go without coughing, the easier it's going to get. And after a day or so, that feeling's going to go away as it heals. Like a bite that's itchy, you just got to heal up. It takes a little while. So keep some water around. Keep some water by your bedside. And remember the slow, deep breaths. When you're feeling something, you do something else other than coughing. You say, I'm not going to cough. I'm going to take a deep breath. I'm going to sip a little water. I'm just not going to cough. Okay? Because you can control it, right? You've been doing it. So you know it can be done. You know it can be done. And that means anytime it starts happening, you think about it. You can control it. It's when you're not thinking about it that it happens by itself. You're still feeling it, but you're controlling it. Remember the slow breaths too. So, again, that nasty feeling is there, huh? But you're controlling it now. It's not controlling you. You've gone almost half an hour now. I think you can keep doing it on your own now, can't you? I think you can. Yeah. So what I'm going to do now is I want you to keep thinking of your own. Okay? Keep thinking on your own. Okay? Slow breaths. Okay. Don't let that feeling make you cough, because you know you can hold it back. You've done it. You've done it for half an hour. So you can do it. Not easy. But you're showing you can control it. Okay. 6 slow breaths. Slow, deep breaths. It's bothering you, isn't it? Yeah. But you're controlling it, even though it bothers you, because you're taking control. You're not letting it control you. Okay? So this is what you have to keep doing. You may have to do it for a while. It's going to gradually get easier. Gradually gets easier. Keep thinking about it. Hold it back. Good girl. Keep looking at millennia. And take a slow, deep breath. Slow, deep breath. That helps a little, huh? Taking the slow, deep breath. Okay? Okay. I think you can do it yourself for a while now, can't you? Okay. Let me talk to your mom and dad, but you keep thinking by yourself. You keep control.
My full session with Dr. Weinberger is on our website at habitcough.com.
Please be advised, this was our experience with Dr. Weinberger. Yours might certainly differ, but talk to your pediatrician, talk to your pulmonologist, talk to your child's doctor, and let them know about habitcough.com.